Karen Bass, who's the chair of the Subcommittee on Africa, Global Health, and Global Human Rights, for 5 minutes.
Thank you very much, Mr. Chair, and certainly thank you, Mr. Secretary, for coming back to our committee again. And I actually wanted to follow up on my colleague, Mr. Issa. I too am concerned about intellectual property, but in this instance, I'm way more concerned about global health. And so I know that there are at least a couple of countries in Africa that are ready to manufacture and vaccines. And so I wanted to know where we are in terms of that, exporting our technology to manufacture. And I think that's so important, not just because of COVID, but because of future pandemics. How do we think about the world in terms of increasing the capacity and not just thinking about the profits that could be made? So I wanted to ask you that. I have a couple of other questions too, but maybe you could respond to that right now.
Thank you. And in short, we need to do two things. Beyond the distribution of vaccines that we have access to, we need to increase production, and that means both in the United States but also around the world. And I think we also need to increase production capacity in different parts of the world for precisely the reasons that you cite, whether it's for this pandemic or for anything coming down the road in the future. And it makes sense, certainly on a regional basis, to have countries that can be production hubs. That's going in the future to facilitate getting vaccines out effectively and efficiently, or other health products out effectively and efficiently. So we're looking, in short, at that and looking to see what can be done to either increase or develop, as necessary, production capacity in different parts of the world, including Africa.
Now, I didn't see that in documents I looked in. Are there specific line items that are categories of the budget that you are requesting to do just that? Is there any support that you need from us?
I think that there are a couple of things. In our own budget, we have asked for resources dedicated to helping countries, including in Africa, better develop the capacity to detect, prevent, mitigate the potential outbreak of pandemic. So that's one category, and that's very important. When it comes to the production piece, I don't think, but let me come back to you if I can on that. I don't think that's part of our budget, but let me come back to you on it.
Okay, no problem. I noticed that you had several accounts that were decreased in Africa. Ethiopia, for example, is $34 million below. Kenya and Mali accounts are also decreased too. For Ethiopia, I'm wondering, is that directly related to the conflict? And then I don't know why that would be the case with Kenya and Mali, especially given the problems that Mali is currently facing.
Yeah. With Ethiopia, we are more than deeply concerned about the situation in the country as a whole, but particularly right now in Tigray. And I think we need to look very carefully at the allocation of resources, because, as you know better than I do, we not only have the horrific violence and the atrocities that have been committed, we now have a famine on top of that. So I do want to go back and make sure that we have the appropriate resources dedicated to deal with that. In the first instance, though, we have to get humanitarian access. We have to get a cessation of hostilities so that people can do their jobs. We have to get an end to the intentional destruction of food sources, which is driving it. So I need to take a look and make sure that we are effectively resourced. And let me come back to you in the interest of time on the other countries you referenced.
Okay, so the other area I wanted to ask you about is the staffing of the State Department. Number one, when you entered, are you facing a large number of vacancies? I'm asking you that specifically in regard to the diversity issue, because oftentimes when diversity is mentioned, people feel like they're going to lose something. And so the commitment that I made to the Staff Association was that I would push for an expansion of mid-career positions. I want to know, do you need them? Did you encounter a large number of vacancies and in general about the workforce?
Yes, thank you. Yes, we have significant vacancies to fill, and we also have to have new positions in order to deal with many of the challenges that have already been alluded to this morning, where we are understaffed or under-resourced. That's why we've asked for almost 500 new foreign service or civil service positions, including also, on top of that, 70 for global health security.
Are those career? Are any of those careers?
Yes, yes,
Okay,
yes. And USAID would have the 70 or so positions. But I'd actually love to come back to you on some of the specifics, because we do have gaps that we need to fill, and we need Congress's help. We very much appreciate the support for that.
Thank you for that. The gentlelady's time has expired.